Hi, I'm Sophie Shephard, APA titled Pain Physiotherapist, and I'm very excited to be here at the APS conference interviewing on behalf of the APA, and I'm very excited to be talking to you, Nardia Klem. Do you mind telling me a little bit, by way of introduction, a bit more about you and your work?
Sure. So I am a clinician researcher. I spend part of my time working as an MSK physio and the other part of my time researching pain conditions, and particularly the intersection between pain and mental health, particularly in younger people.
It's such a big area and I think still a very unexplored area, so I'm really keen to hear a little bit more about the work that you've been doing. I guess my first question for you is, what does the research actually tell us about the co-occurrence of chronic pain and mental ill health in young people? What do we know currently?
Well, we know that they're highly co-occurrent, and the data suggests that if you're a young person with a chronic pain problem, you're up to 3 times more likely to have a mental health condition. If you're a young person who has a mental health condition, you are up to 2 times more likely to experience a chronic pain problem. So realistically, MSK physios or pain physios are going to be more likely to see these 2 conditions together than not, particularly in a younger group.
Absolutely. And I guess there's both, when we're talking about pain, we're talking about mental ill health, there's so many contributing factors, potential complexity in that, that, I think trying to get a grapple with that and understand what's happening and some of those relationships can be quite challenging, I would imagine. Given that, how do you currently see the needs of young people who are living with these conditions? I guess, how well are our systems set up to meet their needs currently, do you think?
Not well. Well, it's not simple. I guess that's the headline, is for any clinician it's difficult to effectively manage this co-occurrence holistically. If we think back to our training, we're not trained in that integrated care. We're trained to treat pain, and then mental health is delivered by the mental health professionals. And it's not saying as physios we need to go out of scope, but we need to understand what's within our scope and consider those factors when we're care planning for those younger people. And then I guess more broadly, from a systems perspective, we're just not set up to deliver this integrated care. Like, financially, we're not incentivised to deliver, I guess, more complex care models in the kind of primary care setting. In public, we have so few paediatric pain services, and again, even in them, pain and mental health are rarely integrated in this, in an interdisciplinary kind of model. It's all treated separately.
Absolutely. And I would imagine, I think there's a lot of clinicians, a lot of researchers who are very passionate about this space, but I think what I've observed is that there's often a real challenge with actually making sure that we can really hear from people who are actually living with these conditions and sort of hearing their voices in this. I know that your work has really sort of tried to harness that and really tap into that community to try and hear what those needs and experiences are. Do you mind telling us a little bit more about that aspect of your work and that engagement with the community, and maybe how it's sort of influenced your findings and your work?
So in my research, I'm predominantly a qualitative or mixed methods researcher. So that means I do a lot of interviewing. I don't do a lot with the numbers. So I'm always trying to, I guess, do robust approaches to inform care based on the accounts of people who have the lived experience. So what we've kind of learned over time is that actually young people do want integrated care. They want you to see them as a whole person. They don't, while they might say their pain and mental health are different things, they commonly appreciate they're very connected and one influences the other. So we have to keep that in mind. They want, healthcare that puts them in the driver's seat. They're actually, on the whole, not very interested in these more you tell me what to do kind of approaches to care. They want a plan and they want to be given the information to get on the right track with their lives. And
I'm just conscious that idea of integrated care might be a term that maybe people might not have heard before, or maybe they've heard it but not necessarily heard it explained. I guess, what comes to mind for you when you're talking about integrated care? What does that actually look like, would you say?
From our perspective as physios, we are considering all those different contributors to a person's experience of pain. And so that does include mental health. So it's not just treating these, I guess, more biological considerations. We are also considering the mental health or psychosocial contributors too. And I think there's a lot of concern about that not being within our scope. But if we narrow that down to pain-related, emotions, cognitions, behaviours, it's absolutely within our scope and we should be addressing them. For specific, I guess, mental health conditions, that's where a co-care with someone who is a mental health professional would be really appropriate, and you should be working with them to deliver holistic care.
The thing that jumps out at me hearing you explain that is that I could imagine when you're talking about that sort of integrated care model and having physios who are willing to kind of consider the whole person and start to think about some of these co-occurring issues and factors, that could potentially help fill a bit of a gap, because we know that there are a lot of people who struggle to actually connect with mental health professionals as well. So I guess we know we're not replacing psychologists by any means, and like you said, we've got to respect scope, but I guess, do you see integrated care as maybe being a way to kind of help support and maybe kind of fill that gap a little bit?
I think it can, and as you point out, access to care is such a big problem for young people. So more often than not, they might not have a diagnosis for their pain or their mental health. So we have to kind of go with the clinical picture that's in front of us and help as much as we can within scope. And, if it gets to the point where you believe they actually need mental health input, you can give them options to access that through, mental health care plans, educate them about that. And so we have a role in that too, is helping them navigate the system and get the care that they need.
It's almost like physios are kind of in that situation working as a bit of a connector and getting people in. I think it's so important to hear that, because I think it's something that, like you said, our system currently doesn't do that typically well, but there's so much opportunity for that. Coming back to some of your research and what you found from working with people who have lived experience of pain and co-occurring mental health conditions, I know one of the outputs of your research was actually developing a framework for understanding how these two things kind of relate to each other and that sort of thing. I know there's so much detail we could go into with that, but would you mind maybe fleshing that out a little bit and sort of giving a bit of a summary of some of the things that you sort of found in that?
One of the, I guess, major outputs of the qualitative work we've done is creating a framework to explain this co-occurrence of pain and mental health. Essentially, young people describe pain and mental health as cyclic and interrelated. So the framework is conceptualised as a cycle, and the cycle can be influenced by interpersonal factors, so their external world, relationships, healthcare experiences, sense of self, intrapersonal factors, so emotions, cognitions, behaviours, and overarchingly can be influenced by their context too. So that's discourse about pain and mental health and the environment, and that might be, and from an environmental perspective, like access to care, the physical environment and how facilitating that is for them. And the idea is with this framework that, that sort of cycle of pain and mental health can be driven by those factors in a helpful or an unhelpful way. And importantly, because we are understanding pain and mental health as this interrelated construct, an intervention for the individual that targets one of those factors driving the cycle should helpfully influence both pain and mental health. So I think that gives us a lot of scope and flexibility around, as physios, what's within our scope, can we address it, and it should actually be helpful for both of those two conditions.
Absolutely. And there's already been some things that you've mentioned around ways that physios might start to think about these things or some of the takeaways. But I guess if you were speaking to any physio who might be listening to this, if there was sort of like one takeaway from your work or one key thing you'd like to see them take from your work, what would be the one thing? I suppose we need to really listen to what young people are telling us when we get them in a consult. I think our default a lot of the time in healthcare is, if you're a young person, you're quite well. But we know that the rates of pain are the same as adults,
and mental health is actually highest amongst this age group. So I think our, radar needs to be on for that and to screen appropriately for people that are high risk of a long term of chronicity of both of these conditions.
It sounds like there's so much opportunity in this space for physios to do better. I'm interested if you know of or can recommend any particular resources or places that people might, be able to look for sort of more learning or for resources they might use clinically in this space.
Yeah, I think there are a number of initiatives now to try and, shift the needle a little bit. So a really great one is Young Pain Health. That's a Department of Health initiative. You can just Google it. Has a lot of information about common pain conditions and management approaches. For physios, it's a great place to learn, but it's also excellent as a resource to send to patients. You've also got the Open platform, which is designed to upskill a range of different healthcare professionals in pain management. So that's a really affordable course you can do. And then we have other online resources like This Way Up, which is an online mental health program that includes a chronic pain module too. Very affordable, if not free, to give to patients as well.
Yeah, fantastic. So many interesting avenues for people to go down. Thank you so much for your time. I really appreciate you taking the time to chat with us and to share your wisdom and knowledge. And I hope you enjoy the rest of the conference. And thanks very much for joining us.
Thank you for having me.